Welcome to the Scripps Proton Therapy Center in San Diego, California, the nation's first proton therapy center to treat cancer patients exclusively with pencil beam scanning, a benefit of Varian's ProBeam proton therapy system. Varian has invested more than a decade of research and development into pencil beam scanning, the newest technology to treat cancer with intensity-modulated proton therapy. This center is one of only 3 multi-room proton therapy sites in the world where all patient treatments are performed with pencil beam scanning. Since opening in February 2014, the Scripps Proton Therapy Center has treated a wide variety of cancers, including many complex tumor cases, with Varian Medical Systems' state-of-the-art ProBeam proton therapy system. At the center, pencil beam scanning technology is integrated with high-quality onboard imaging, the Eclipse treatment planning system, and the ARIA Oncology Information System to enable the efficient treatment of even the most complex clinical cases. This breakthrough system integrates the radiation therapy technological standards with the power of protons. The technology is supported with Varian's robust training programs and exceptional support. In addition to the state-of-the-art ProBeam proton therapy system, the design of the Scripps Proton Therapy Center keeps both form and function in mind, and the result is a beautiful center of healing. Patients feel at ease from the moment they walk in the door. And just off the lobby, the center also boasts a diagnostic suite that includes MRI, CT, and PET-CT with imaging capabilities. At this center, young patients have a dedicated space through a partnership with Rady Children's Hospital San Diego. Since the proton beam is designed to minimize damage to surrounding tissue, physicians have found that the ProBeam proton therapy system is particularly well suited for pediatric patients. Proton therapy is at the forefront of cancer care. It uses positively charged nuclear particles to deliver precise treatment in specific doses. The ProBeam proton therapy system enables clinicians to precisely target tumors and reduce radiation dose to healthy tissues and organs. At the Scripps Proton Therapy Center, there are 5 treatment rooms. Each treatment room has its own dedicated control room. Leaded doors are not required due to the use of shielding walls and a maze hallway design. 3 treatment rooms have gantries for treating more complex tumors, and 2 rooms have fixed beams for simpler treatment plans. The layout of each treatment room is designed with safety and efficiency in mind. The ProBeam proton therapy system is a complete end-to-end solution that synchronizes all proton therapy activities. It is seamlessly integrated with the ARIA Oncology Information System, as well as Eclipse treatment planning for efficient workflow in one database. The treatment room is designed for therapists by therapists to ensure smooth workflow. Large monitors are visible from anywhere in the room to streamline patient positioning, and 2 hand pendants are conveniently located and have an intuitive design. Designed for radiation therapy professionals, Varian's Dynamic Peak Imaging System ensures accurate patient positioning. The imaging system consists of 2 orthogonal X-ray imaging sources paired with Varian flat panels mounted at each side of the nozzle. The X-ray imaging is performed at the Gantry IsoCenter. A full 360-degree cone beam CT is an option for gantry rooms in both single-room and multi-room designs. The intuitive Dynamic Peak workflow interface was also designed to be easy to use. It enables clinicians to perform difficult tasks simply, efficiently, precisely, and safely. Once the patient's position has been confirmed, the therapist calls for the beam and initiates treatment. The Dynamic Peak pencil beam scanning technique precisely controls the energy and direction of the proton beam to deliver the designated dose distribution to the tumor target volume, maximizing the radiation dose to the tumor while providing a low dose to healthy tissues. This advanced treatment delivery system is designed for optimal dose conformity. It can deliver 2 gray per liter per minute for faster treatment across the full energy range, even at tumor depths 4 to 7 centimeters, without the need for a range shifter. The scanning system also eliminates the need for patient-specific devices like collimators, apertures, and compensators, further streamlining workflow. Pencil beam scanning allows the proton beam to paint the tumor in 3 dimensions. Our unique continuous beam moves fast, and with a layer switching time of less than 900 milliseconds, meaning it is possible to treat a large tumor with many layers in less than 1 minute. Real-time dose measurement and real-time beam position verification ensure accuracy and safety. The treatment control system is completely automated to allow the beam to be switched from one treatment room to another based upon the treatment schedule to allow the therapist to be as efficient as possible. Now that you've seen this exceptionally fine-tuned and innovative cancer treatment, you are invited to peek behind the scenes to see the world-class technology that drives the Varian ProBeam system. The superconducting cyclotron is at the heart of the Varian proton therapy system. It uses powerful magnets and electrical fields of alternating polarity to accelerate a beam of protons. The Varian Proton Accelerator is an isochronous cyclotron with superconducting coils and the first of its kind designed specifically for the clinical application of pencil beam scanning. It speeds the protons up to 2/3 of the speed of light. The cyclotron magnet design was one of the key innovations developed in collaboration with the National Superconducting Cyclotron Laboratory and is at the heart of what makes the Varian ProBeam system unique. This innovative cyclotron produces a continuous and stable proton beam. The energy selection system adjusts the proton's beam energy to the specific dose and depth prescribed in the treatment plan. The proton beam travels from the cyclotron down the beam transport system. The beam transport system consists of a series of focusing and bending magnets, as well as diagnostic measurement tools, used to transport the proton beam from the cyclotron to one of the rotational gantry or horizontal fixed beam treatment rooms. The gantry contains the last part of the beam line and enables rotation. The scanning nozzle rotates around the patient and the mechanical isocenter. It is particularly fast and can rotate at 1 revolution per minute. This allows the quick delivery of the proton beam at any angle in order to provide flexible and maximum access to the tumor volume with high accuracy. The gantry, treatment table, and 360-degree cone beam CT at isocenter form an integrated system, enabling precise positioning of the patient for optimal workflow. Investing in the ProBeam proton therapy system may propel a clinic to the forefront of cancer care and enable it to expand through innovation today and into the future. Clinics not only receive cutting-edge technology and support from a fully committed service team specialized in proton therapy, but also a fully integrated system and a network of colleagues. The Varian ProBeam proton therapy system can be configured exactly according to your specific clinical needs and business requirements, from a compact single-room solution or a facility with multiple treatment rooms. Varian Medical Systems is fully dedicated to the success of proton therapy and provides individual programs to help ensure that every Varian ProBeam proton therapy system supports our customers' specific oncology service strategies. Equipment reliability and clinical uptime are optimized through a dedicated service team, allowing you to focus on what you do best. With a leading position in developing advanced clinical oncology technologies, Varian Medical Systems installs and maintains forward-compatible proton therapy treatment centers and clinics around the world.